Okay, well, good evening, everyone. I am so excited because we're having our first Airway Health Solutions featured airway dentist, and we have Dr. Jaclyn Park. So welcome, Dr. Park, or can I call you Dr. Jackie, as I always do?
Thank you so much, Lauren, for having me.
Oh, it's a pleasure. I get such a thrill when I hear all the wonderful things you're doing, and I see your Instagram and some of the posts that you're doing on social media. But why don't you tell us a little bit about your airway journey? I know you're fairly new to this. That's why I think it's always exciting, because we have a lot of aspiring airway dentists out there. So you just got started with us, in the summer, correct? In July of 2020?
I believe it was July, yes.
Yeah, so tell us a little bit about your airway journey so far.
Well, I was doing a lot of Invisalign, and I did see some limitations on it because from Dr. Miralia's teachings, I learned that the expansion is the way to go. And I totally believe in that. I almost do no IPR, and all that. But this was an eye-opening for me. And especially without any surgery, without any, it was actually very easy to do.
Terrific. So what was your biggest takeaway, would you say, after you took our mini residency?
I didn't actually realize that you could remodel the whole, facial features, if you will.
Yeah.
And that wasn't going to be possible with just the clear aligners. I mean, that could just expand to the point, but, especially going, moving forward and, making it wider, you need a little more, not just a little more, but more help than just using the Invisalign, if you will. So, right. And especially in your own case that you are, doing it for, I don't know how long, but you already expanded. You said about 4 millimeters.
Yeah, so I actually started at 29 millimeters. I have my expander right here, so you can kind of see it. It's getting there, right? I'm so excited.
That's fantastic.
Yeah, and even I try not to look at yourself, but I can't help it because I can now see my molars more than I did, say, a year ago, or 6 months ago, rather.
Of course.
But it's exciting. It is a commitment. And that's what we always teach too in our course, that you don't want to try to convince patients to do this. You want them to choose it. And, many times they may not go the full gamut of, say 9 millimeters. Maybe they'll just have their breaking point at 6 months and get to 4 millimeters. And then the rest you can, finish up with the aligners, as we learned, right?
That's right. So in combination, you can achieve so much. And on the way, of course, you're going to improve the patient's life. And this is just amazing.
I can't wait for you to get your first patients when you're done. And then we'll have you come back and you can tell us about.
Sure. Absolutely. I have kind of a couple lined up already. So I can wait to come back and, tell you about it.
Well, I guess a lot of people, I get a lot of phone calls from doctors and they're a little bit hesitant about kind of pulling the trigger, right? It's kind of a big investment. It's a lot of time involved, and, something new is always fearful. So maybe you can share with us your experience of how did you kind of get over that hurdle of starting something new and taking our mini residency?
Well, I guess the lockdown had something to do with it. And, I had a lot of free time, to be honest, and I didn't have to travel to take the course. I actually knew a friend of mine who actually went up to take the course and all that, and I was always interested in doing that. But I took advantage of doing this at home, and the concept was amazing, and I could not believe the actual cases when Dr. Moralia showed, with all the his photos and everything. It was just a whole transformation that I didn't think it was possible with just with Invisalign. So there was, and in fact, I actually have to admit I only did the adult course, but I'm ready to take the pediatric course as well.
Well, terrific. And that's something too I recommend. Also, if someone wants to maybe they don't want to take both days, that's why we have it separate. You can take one day at a time, and you can mix match the month. So it's you can kind of ease into it if you would as well.
That's right. And also in my office, I really do not see pediatric patients. that's why I thought maybe I wasn't gonna get into it. The concept is similar, but now I actually saw a couple of children in my office recently, actually, and I think I may have to incorporate this before doing like a teen, Invisalign.
Right. Well,
right.
You don't know what you don't know, right, Dr. Jackie? And then once you know it, you want to help everybody.
Right. Right.
Wonderful. Well, your patients are lucky to have you to offer this type of treatment. Not only are you helping them look better, but they're going to be feeling better as well. And a lot of patients, they'd be asking for Invisalign, but many of them don't know all the hidden benefits behind it.
That's right.
So how do your patients feel when you tell them some of the hidden benefits, which we know are the true benefits behind the clear aligner therapy?
When I deal with when I explain to the patients about the need for the Invisalign, there's actually a difference. What the patient, one is just straightening the teeth, and mostly they are concentrated obviously on the anterior teeth. And my approach is the whole improving the occlusion, improving the health, oral health, benefiting from that. So when they're actually aware of the box with a right fitting lid, that concept, when I explain to them, they actually, oh, wow, I didn't realize that's the case. And, the straightening the teeth is just the fringe benefit. It's not the main, the reason why you're starting the case.
Right, but it certainly makes it easier, right, for them to accept the treatment because they're going to end up with this beautiful smile. It's kind of like the cherry on the sundae, the proper alignment, right?
Absolutely.
So I thank you for joining us tonight. If you want to get in touch with Dr. Jackie, the website is listed on Facebook, but you are located at 115 East 57th Street, New York, New York. So a hop, skip, and a jump from me. So next time I'm in Manhattan, I'll come swing by. And your website is jaclynparkdds.com. So any final thoughts, Dr. Jackie, about your experience in being featured as an airway dentist that I might have missed?
No, I think I pretty much covered everything. I have so much to offer, and hope to actually learn more when I take the other course, the pediatric course as well, to incorporate it to my practice.
Wonderful. Well, we'll look forward to having you back then again.
Will do.
All right. Thanks for joining us. Have a wonderful evening.
Right.
Thank you. Bye-bye.
Bye-bye.